Let me tell you a story. One day in the clinic, there was an emergency. What happened? A teenage girl was rushed into the ER. She was actually restless and unconscious. I mean, when I say restless, it was as if she was mad or she was really mad. Seriously. So, while in the ERO, line was set, blood sample was taken, and then fluids were given, and also injections too were given. So at some point, she was now stabilized. So she was now transported to the female ward for further treatment and management. So after a while, that episodic restlessness and unconsciousness started. So she was now given some depressant drugs, and then she was okay again. Now, after the test was conducted, I discovered that she was actually having cerebral malaria.
Obìnrin, obìnrin.
Her malaria was actually 4 pluses, and it had already got into her brain. Shock you, Abby? Okay. All right. Let me just tell you something. Malaria is actually one of the most deadly diseases, even if currently it's not actually part of the top 10. But of course, it's still rated as one of the most deadly diseases, of course. And of course, according to statistics from WHO, you find out that malaria is actually, it kills over 600,000 people in a year.
What's going on in this life?
Now, in this era, especially this part of Nigeria, this part of the world, Nigeria precisely, we actually, of course, despite the deadliness of malaria, we actually overlook it. I know it's actually due to the fact that a lot of drugs are around. There've been intervention of a lot of drugs, anti-malaria drugs to help cure the disease. But aside that, people still ignore these drugs and also ignore the illness. How do I mean? I, in my few years of practice, I've observed that some persons walk about with 2 pluses, 3 pluses, 4 pluses malaria.
Obìnrin, obìnrin, obìnrin.
In fact, them coming to do that stuff is because they've already been broken down by the disease. They've left it for a while. Now, let me just give you an overview of malaria. Malaria is actually